Hello and welcome to the national webinar series we are hosting, focusing on case studies that can help you understand some of the ways in which you can develop your cross-system intelligence functions. If you're not familiar with us, the Strategy Unit are part of the NHS, and we conduct a range of work across the health and care sector in things like advanced analytics, evaluation, decision support and strategic advisory. We've previously written a report on advancing analytical capability in ICSs commissioned by NHS colleagues, so are heavily invested in this area. We also act as the development centre for the Midlands Decision Support Network, which supports the infrastructure of intelligence functions across the Midlands by providing systems with analytical training and development, scale working, and the management of professional networks, amongst other things. So the bulk of today's session will be handed over to colleagues from one of the case study sites that we've included in our toolkit to support systems to develop their intelligence functions, and more on that in a minute. The point of these sessions is to spread learning from elsewhere around how systems can develop their own intelligence capabilities. Now, of course, we recognise that each system is different, but that also there are some commonalities. So we hope that through these sessions we can provide some diversity of examples that you can tailor to your own needs. Before that, though, I'll talk for a few minutes about what's in the NHSEI guidance around these functions, as well as our toolkit, to give you an idea of the support that will be available to all once the guidance is released. So I'll kick off with a bit of context for today's webinar and why these intelligence functions are high on the to-do list right now. So back in 2020, the next steps for ICS's document announced the expectation for all ICSs to develop a shared cross-system intelligence and analytical function. And this was reiterated in the design framework for ICSs published last year. And over the past 6 months, the ask has been clarified in the upcoming guidance document from NHSEI. So this guidance describes what an intelligence function is. In other words, it's a system-wide function, including analysts from across an ICS, working in partnership on quantitative and qualitative insights. And then it covers what it should do. So it says here that it should work on system-level analytical questions to inform strategic, clinical and operational decisions. And these should be informed by a person-level linked data set and support a PHM approach to care. So the guidance provides a spectrum of these different types of decisions. So an intelligence function will support strategic decision making through things like providing a wider understanding of how services interact with their populations and each other, and also synthesizing evidence from a range of sources to respond to questions and facilitate action. So strategic questions could be, for example, at which points in a care pathway are inequalities occurring and why? A question that would require more bespoke analytical methods, more likely to be the preserve of the intelligence function. And then operational decision making might focus on ways to improve the way a system delivers and manages services, drawing on predominantly internal sources of evidence to the system. And then clinical decision making perhaps focuses on common clinical questions, such as how can we identify gaps in care for individuals that can exploit the potential for automation and those PHM platforms. So when it comes to thinking about the resources and mechanisms that systems may need to make these decisions, the guidance provides a maturity matrix detailing what an emerging, a developing and a maturing function might look like. So that's a really brief summary of the guidance, and that's going to be released by NHSE very soon. There's also a toolkit, though, that the Strategy Unit have produced to support this guidance. And the toolkit is essentially designed to help systems apply that guidance. And it starts from the premise that systems are already thinking about intelligence functions. So, don't think of it as a manual. It's a range of curated resources that systems can draw upon for their individual purposes. So they're there to challenge thinking and also to offer practical routes forward. So nothing in it is mandated, it's all designed to support you, dependent on where, as a system, you are at. And it does this in 4 ways. First of all, it describes how to make the most of different types of analysis in support of your system's priorities. It then provides a set of tips to get started with your intelligence function and some principles to guide your planning. And this is followed by a set of resources that can help you to design and implement your function. And then finally, we provide learning from elsewhere in the form of 10 case studies from other places who have made progress in their own intelligence development. And these case studies, that's the reason why we're all here today. So that's a whistle-stop tour of the context and support for these intelligence functions. So for the rest of the session, we'll be hearing from colleagues from one of these case study sites to provide you with some practical advice and learning from those who have already started on this journey. We hope that you find it useful.